This culminated in a 2-day bonfire ceremony in which victims described their experiences and perpetrators asked for forgiveness. Ceremonies were relatively cheap, costing between $150 and $200 in total for all participants. They also incorporated traditional rituals to promote community healing. After the ceremony, Famble Talk set up a symbolic peace tree in each village and in some areas communal farms to further sustain community healing. It additionally helped establish a Peace Mothers group to discuss gender targeted atrocities uh, perpetrated during war. As such, this intervention could have some impacts other than reconciliation, for example, on economic activity, where we discuss alternative accounts. We lay out why effects on psychological health and social capital are likely due to reconciliation rather than these other impacts. In supplementary text S3, we also discuss how local level reconciliation processes, such as the one implemented by Famble Talk, compare with national level reconciliation processes. Healing through reconciliation. Reconciliation processes such as this one could theoretically have both positive and negative psychological consequences. On the one hand, they may improve psychological health if sharing war accounts has a cathartic effect or leads to forgiveness, which has been shown to improve trauma, anxiety, and depression, particularly when induced in the context of forgiveness therapies. On the other hand, they may also prove traumatic because they evoke painful war memories without allowing for gradual habituation or desensitization. In this regard, reconciliation processes are similar to single session debriefing, which seeks to counsel patients by exposing them briefly and intensively to traumatic events, but has been shown to have limited therapeutic value. In contrast, gradual exposure therapy has been shown to be more effective for mitigating post traumatic stress disorder, PTSD. Negative psychological effects associated with reconciliation need not be concentrated among those who were directly victimized. For example, other community members may experience various uh, vicarious traumatization as they hear about new atrocities committed during the war. In fact, studies of those who have testified in national TRCs, Truth Reconciliation Commissions, suggest that this participation produces mixed emotional responses, may not improve psychological health, or may even correlate with worse psychological outcomes. It is difficult to infer causal effects by comparing those who testified with those who did not, because those who chose to testify may have experienced greater violence exposure or had a different psychological makeup. We use a randomized design to mitigate this type of endogeneity concern and better identify the effect of reconciliation on psychological outcomes, including trauma, anxiety, and depression. We also examined whether the effects vary systematically based on the degree to which individuals experienced war violence. Reconciliation processes may also affect societal healing through their efforts on social capital, which is conceptualized as social networks and norms such as trust and reciprocity that arise from these network ties. Social capital effects could also arise as a consequence of forgiveness. For example, individuals may stop avoiding places and activities associated with perpetrators and form social ties with them after forging after forgiving them for past actions.